nasal endoscopy is when your doctor uses a tube with a camera on it to see what's happening in your esophagus, stomach, or intestines. The doctor puts the tube up your nose and down your throat, but don't worry, your nose and throat are numb, so you shouldn't feel it. Having a nasal endoscopy usually takes the place of having a longer procedure with anesthesia. A nasal endoscopy might not be what you're used to, but it takes a lot less time than having anesthesia. When it's time for your nasal endoscopy, you'll go to a Children's Colorado location with a parent or guardian. Make sure you don't eat 2 hours before you come to the hospital. When you arrive at the hospital, you will meet with your doctor in a regular clinic room. If you'd like a child life specialist to be there with you, just ask. They can help you feel comfortable and relaxed. When you get to the room, the doctor will talk to you and your parents about what will happen. Then, he or she will ask you or your parents to sign some papers saying it's okay to do the procedure. Then, you go into a different room. This room will have a comfy chair. You get to put on these cool glasses that are playing a movie just for you, whatever movie you want. Then the doctor puts some medicine in your nose that makes it numb. This is so you don't feel the scope. The medicine might make your nose and throat feel funny or even lumpy. This is totally normal. The person performing the endoscopy, usually the doctor, has an assistant to help. After they numb your nose, they check to make sure that you're seated correctly. Then, they take this tiny camera on the end of this bendy scope, and they put it through your nose and down the back of your throat. The scope is long like spaghetti, but smaller than a pencil. The team moves the camera further into your nose and throat to look at your esophagus, stomach, and maybe even your intestine. Then they use a tool to take teeny tiny pieces of tissue, smaller than this pinhead, from the areas that need to be studied. When they're all done, they quickly pull the scope out and you're all done. The whole thing only takes about 8 minutes, and you're usually only at the hospital for about an hour. Many kids who have a nasal endoscopy can go right back to school when they're done. You might have a sore throat, sore chest, or a bellyache for a little while, but it should go away quickly. You can usually begin to eat about 30 or 60 minutes after the endoscopy when your throat feels normal again. Most kids do great with this procedure, but don't be surprised if you feel like you need to laugh, cry, or hold someone's hand. Or you might feel totally normal. The good news is that it's usually over before you know it.